It is high-frequency electrosurgical generator with 6 functions, mainly applicable for cutting and coagulation, and bipolar coagulation of muscle tissue. Connect the ports on the back. The power supply socket. Connect to the ground. The knob to adjust the sound. Port to foot switch. Connect the power supply cable. The knob to adjust the sound. Turn the knob to the right to increase the volume, and turn the knob to the left to decrease the volume. Connect the foot switch. Place this groove upwards and insert it into the port. If need to remove it, press this button and to pull it out. OK, all connected. Come to the front side. This area is for monopolar cutting. For monopolar coagulation in middle and right area is for bipolar coagulation. Power switch. Port to the negative plate. The port for connecting endoscope. Port for electrosurgical pencil or endoscope connector with diameter of 4 mm. Connect to forceps for bipolar coagulation. Turn the power on. Here is an error and red indicator for alarm, because the negative plate is not connected. We connect the negative plate to generator. Insert the connector in. Then connect the plate to the clip. Open the clip softly. No force or the clip will be damaged. Tear off one side paper and insert the negative plate into the clip. And press down the clip. See, the indicator turns to be green, indicating the negative plate already connected. The negative plate is attached to the animal's muscle-rich parts, such as the calf, buttocks, thigh, and back. OK, it is connection of the negative plate. It is port to connect the endoscope connector with diameter of 8 mm. Compatible with this connector, connected to the endo port. With inner diameter of 8 mm, inserted into the port directly. And the other end can be connected to the instruments of laparoscope, such as electrode hook, electrode ballpoint. Connect those laparoscopic instruments. OK, take it out. This port is for output of electrosurgical pencil. This is an international standard. The yellow button for cutting. The blue button for coagulation. The generator supports both foot switch and handle control. 2 buttons on handle also can be controlled by the foot switch. The yellow switch for cutting and the blue switch for coagulation. Then use this electrosurgical pencil to perform surgery. If it is endoscope connector with diameter of 4 mm, whether it is connector with single hole or 3 holes, connect the single hole to the single left port, and connector with 3 holes to the 3 ports. The other end of connector connects to the pencil or endoscope instruments. There are 3 ports for this socket. The left one is for energy output. The middle one is the signal end of the electrosurgical cutting. The right one is the signal end of the electrocoagulation. Connector with diameter of 4 mm and the left one of 8 mm. Same function, but different connector. Depends on which connector the veterinarian has. Both of 2 ports can connect endoscope. Connect the electrosurgical pencil. Next, introduce the bipolar coagulation. Connect the bipolar forceps. It has no positive or negative poles. Just plug the connector into the port. Then connect the bipolar forceps to the connector. Press this button to switch the monopolar to bipolar mode. Then the blue indicator lights up. Press the blue foot switch for coagulation. It is bipolar output. Well, now need to connect the negative plate in bipolar mode. Remove the negative plate. Switch to the bipolar mode. Blue bipolar indicator lights up. Press the blue foot switch to perform the bipolar coagulation. Switch to monopolar mode. Press the bipolar button again to close the function. The monopolar mode uses the electrosurgical pencil. It shows the error and an alarm, indicating the negative plate not connected. We connect the negative plate. Indicator light screen. Becomes normal working states. Okay, come to see the cutting area. There are 3 cutting functions: pure cutting, blend cutting 1, and blend cutting 2. Pure cutting is cutting with 100%. Cutting without coagulation. Blend cutting 1 is 80% cutting with 20% coagulation. Blend cutting 2 is 60% cutting with 40% coagulation. The efficacy of blood coagulation increases in sequence and gradually increase the hemostatic effect at the same power. 2 monopolar coagulation functions and soft coagulation. Press this button to switch to functions. We introduce the applications of the 2 coagulations later. Then the bipolar coagulation. Press the bipolar button and indicator turns to be green. Press the blue foot switch to output the bipolar energy. Press the button again to close the function and switch to the monopolar mode. In surgery, generally we use pure cutting and blend cutting 1. Normal surgical cutting can be performed at a power of 40 to 70 watts. If applied to vascular surgery, polyprimeval, etc., the power performs between 70 to 100 watts. The specific function is selected according to the coagulating effect. After selecting the function, adjust the output power according to different surgical needs. Press those 2 buttons to increase or decrease the power value. If it performs some major surgery, such as breast cutting, it needs to increase high power, up to 100 watts. Or if it performs the transurethral resection at the prostate. In pure cutting function, the power needs to be 150 to 250. To perform the underwater cutting, it is prostatectomy. Press the blue button or blue foot switch to perform coagulation. If it is a large area of bleeding, choose the spray coagulation. The power is between 30 to 60 watts. According to different surgeries, different parts, to adjust the power value. And the soft coagulation is applicable with cosmetic surgeries or local, point-like bleeding. Next, talk about some precautions. How to judge if it needs to replace a new pencil? There are some troubles after a long time using it, like short circuit or water got inside. The generator shows this error and alarm, indicating it is the time to replace new electrosurgical pencil. It is consumables. When we use it, be sure to pay attention to the error prompts and alarm. Bipolar coagulation function, generally used in neurosurgery, or coagulation and closure in laparoscopic. In neurosurgery, the power is between 15 and 25 watts. In laparoscopic closure, the power is between 30 and 50 watts by using closed forceps. In bipolar function, if it is small bleeding point or small separation point, we use this kind of forceps and adjust the power to be 20 watts, 10 to 20 watts. If using wider closing forceps or Maryland, the power needs to be 30 to 40 watts, or even up to 70 watts. The specific power should be adjusted according to the size and difference of the closure and coagulation tissue. Okay, it is all the introduction about this electrosurgical generator.